Now let's look at needles that we'll use on our patients. A couple basic things we need to know about needles are the gauge. So that's the thickness of the needle. You might see gauge as G. So 28G is 28 gauge. We also care about our length, how long the needle is. And a big thing we have to keep in mind is that if we see a lower gauge number, so a smaller number, that means a larger needle. So just remember, LL, lower gauge number, larger needle. And these are important because when we are selecting our needle, we need to keep these two in mind based off the purpose or the route we're going to go through, the size of our patient, and what type of solution we have. So like the thickness of our solution. So if we are giving, say, an IM injection on a really big patient, we're going to need a larger needle and a longer needle. Versus if we're going to give, say, insulin into the subcutaneous fat, we would need just a teeny tiny needle, okay, just to get into that fat area. Let's look at the different gauges, okay? Here, these needles are not all the same length, okay? Some are 1 inch, 1.5. I think there's like a 5/8 one. But I just want to show you what the gauge looks like up close. Here we're looking at an 18 gauge needle. This is not the biggest needle. It goes down to like 14, 12, I think even 10. But our gauge is the thickness of the metal part. And again, normally you would not want to touch this bit, but I'm not putting it in anybody. I'm just showing you guys. Okay, see how thick that is compared to this 28 gauge needle. Okay, this one is so teeny tiny. Okay, I think it might even fit into the bevel of our 18 gauge. So the lower gauge number, the larger needle. So this is an 18 gauge and it is much bigger than this 28 gauge or even this 25 gauge. And again, how you're going to know which type or which size needle to select is going to be based off the purpose of the injection. So why are you giving it? Are you giving it for an IM? Are you giving it subcutaneous, intradermal? And we're also going to base it off the size of our patient. If we're giving an IM injection, we would choose different sizes, say for like a John Cena sized man, maybe I would use this size. But if I was going to give it to a little baby IM, I would select this 25 gauge needle. And we would also base it off of the viscosity of the solution. So just how thick it is. So if you're giving a really thick medication, you just might need a larger needle. And just a little review on our needles here. So we have our needle shaft here, this metal bit. And then really important bit we need to make sure we know where it is our bevel. So that's just the opening of our needle here, that little hole. And then we have our hub and then our hub opening. Okay, so this is where we would lock in our syringe. Another way we might see our needles too is they might already be connected to a syringe here. And again, on our label, it will say what size of needle that is and the size of our syringe. Whenever we are using this type of syringe and needle, you just really need to make sure that you are still locking it in properly because they are going to be loosely put together. And so if you don't lock it in, it will come out. And here are different times that you'll use these types of needles. So really with intramuscular, you could technically use any of these size. It just is going to depend on like, why are you giving that IM? Where is it going? What's in it? How old is your patient? Again, how big are they? For your subcutaneous needles, they're going to be 25 to 27 gauge. So I didn't have any 27 gauge needles, but 25 to 27. And your intradermal, 25 to 29. So just really tiny needles for both of those. And again, the length on these are all different, and I didn't write them down just because I didn't have enough space. But the length of the type of needle that we need is really important, because the length is going to determine how deep we're going into the skin.